I'm Sarah, and I grew up Amish in Pennsylvania. And I need to start with this because the internet loves one dramatic answer. Either Amish women always have babies at home with no help, or they secretly rush to the hospital but won't admit it. Real life is not that simple. So today I'm going to answer the question people keep asking me in plain language. How do Amish women actually give birth? Is it home delivery or is it hospital surgery? And I'm going to say this with respect, because birth is private and Amish people value privacy for a reason. But we can still talk honestly about the patterns, the choices, and what usually happens when things go normal and what happens when things don't. First, let me paint you a picture that most outsiders don't understand. In many Amish homes, pregnancy isn't announced like it is online. There's no big gender reveal, no social media photos every week. A lot of the time, it's quiet. You can be visibly pregnant, and people still won't make a big thing of it in public conversation. Not because they don't care, but because modesty isn't just about dresses and bonnets. It's about how much attention you draw to yourself, even with something as beautiful as a baby. Now, the first big fact that changes everything is this. Amish births are not all the same, because Amish communities are not all the same. Some are more traditional and cautious about the outside world, and some are more comfortable using certain services. So when someone says, "Do Amish women give birth at home?" the honest answer is, many do, yes, but not all. Amish babies can be born at home, in a birthing center or clinic, or in a hospital. So why do so many choose home birth? People think it's only religion, but a lot of it is practical, cost matters. Many Amish families pay cash and don't use traditional commercial insurance the way most Americans do. When you're part of a culture where large families are common, a hospital bill multiplied by 6, 7, 8 babies is not a small thing. Home birth with a midwife can be far less expensive, and that reality shapes choices. Comfort matters too. Home is familiar. Home is quiet. Home means you can labor without hospital lights and strangers coming in and out. It also means your husband can come and go, family can help with food, children can be in the next room with an auntie, and after the baby is born, you're already in your own bed. And then there's the trust factor. Many Amish women prefer caregivers who understand their culture, who are respectful about privacy, and who aren't going to treat them like they're weird. Some midwives are Amish. Some are not Amish, but have worked with Amish families for years and know the rhythms, the modesty, the way decisions are made. Now let's talk about what a home birth usually looks like, because it's not what movies show. It's not candles and silence and suffering alone. Usually there's planning. Usually there's prenatal visits, though depending on the community, some women start prenatal care later than what's typical in mainstream America. There's a documented pattern in some Amish communities of fewer prenatal visits on average and people entering care later in pregnancy compared to typical non-Amish patterns, partly shaped by custom and partly by access and comfort with the medical system. And here's something outsiders don't realize. Even when a family is home birth minded, they often still have a plan for what happens if something changes. That can mean a driver on call, or knowing which hospital is closest, or the midwife having a relationship with a hospital for consultation and transport when needed. The goal is not to prove something. The goal is a safe mother and a safe baby. Now, the second half of your question, hospital surgery, let's say the baby is breech. Let's say there are twins. Let's say there's heavy bleeding, or the labor isn't progressing, or the baby's heart rate is concerning. In those cases, Amish families absolutely do go to the hospital. And yes, that can mean a C-section, which is major abdominal surgery. The reason I'm saying this so directly is because the Amish never go to hospitals idea is just not true. Many Amish do use hospitals, especially for situations that are clearly higher risk. And here's the part people love to argue about online. How often does transfer to a hospital happen? We actually have a strong piece of evidence for southeastern Pennsylvania because there was a 25-year study of planned home births attended by certified nurse midwives in a group that was primarily Amish. It looked at 836 planned home birth pregnancies. Most births still happened at home, 733 of them, and the maternal transfer to hospital rate was reported at 5.6%. Almost half of those transfers were for things like ruptured membranes without labor or failure to progress. Neonatal hospital admissions were low at 0.75%. So what does that mean in normal language? It means that in that setting with trained midwives, most planned home births stayed home. But a meaningful minority did transfer, and those transfers weren't failures. They were part of the safety net. They were what happens when you're watching and you decide this is moving outside the safe zone for a home setting. Now, let me say something that might surprise you. In some Amish communities, privacy is such a big deal that even home visits can feel stressful because neighbors notice. A report from a midwifery program serving Amish families described that women actually preferred going to a clinic for privacy and protection from curiosity, because it's frowned upon for children to know too much about pregnancy or childbirth. So yes, home birth is common in some places, but there are also Amish women who choose clinic-based birth because it gives them privacy while still feeling more personal than a hospital. Now, I want to address the question underneath your question. People aren't just asking where Amish women give birth. They're really asking, do Amish women avoid pain relief? Do they refuse medical care? And again, the honest answer is, it depends. A home birth setting usually means you're not getting an epidural. Some women want that. Some are afraid of it. Some would take it if they were in the hospital. Some don't want it at all. There isn't one Amish rule book for pain relief that every woman follows the same way. And a lot of it comes down to community norms, the husband and family's opinions, the midwife's approach, and the woman's own personality. But one thing is consistent culturally. Many Amish women are raised to be capable, steady, and not dramatic about suffering. That doesn't mean they don't feel pain. It means they often feel pressure to be quiet about it. That's not romantic. That's just the reality of a modest culture. Now let's talk about something even more real. What happens after birth? In mainstream culture, people post a photo and move on. In Amish culture, there's usually a lot of work happening quietly behind the scenes. Women, sisters, cousins, neighbors show up with food. There's help with laundry, cooking, older children. Postpartum care can look very community-based. And then there's another reality, the newborn care that's routine in hospitals. Screenings, checks, may or may not happen automatically if the baby is born at home, unless there's a system in place. That's why some midwifery programs have worked to improve access to newborn screening and postpartum follow-up in ways that fit Amish life, including home or clinic-based care. In the program report I mentioned, newborn metabolic screening compliance was reported at 95%, and breastfeeding success by 6 weeks was high among participants, with education and support making a difference. Now, I want to say this carefully because people love turning this into a fight. Home birth can be safe in the right circumstances with skilled care, good screening, and a clear transport plan. The Pennsylvania study I cited is often pointed to because it documented outcomes in a real-world setting for a primarily Amish population with certified nurse midwives. But also, hospitals save lives. C-sections save lives, and anyone who makes fun of a woman for needing surgery to bring her baby into the world has never understood what birth can become in a matter of minutes. So if you want the clean answer to home delivery or hospital surgery, here it is. Many Amish women do give birth at home, commonly with a midwife, because it fits their values of privacy, modesty, family closeness, and because cost and practicality matter. And Amish women also go to hospitals when it's needed. Transfers happen, surgery happens, and in a documented southeastern Pennsylvania setting of planned home births attended by certified nurse midwives, a minority of cases transferred to the hospital, often for stalled labor patterns or ruptured membranes without labor, things that aren't rare in childbirth overall. What most people get wrong is thinking it's one extreme or the other. It's not no doctors ever, and it's not all secret hospital births. It's a spectrum of choices inside a culture that cares deeply about privacy, humility, and doing things the plain way, while still living in the real world where birth can be simple one day and complicated the next. And if you take one thing from this video, let it be this. Amish women are not characters in a story. They're mothers. They're daughters. They're real women making real decisions, usually with less money, less public support, and a lot of responsibility at home. If you have questions you want me to answer next, like what prenatal care looks like, what midwives actually do at an Amish home birth, or what happens when there's an emergency, leave them in the comments. I'll tell you what I can, honestly and with respect.